The Health Department reports around 3,900 COVID-19 infections among minors since the resumption of in-person classes. Let's get more details from JC Cosico, who's reporting to us live from the DOH Central Office in Manila. Hi JC, good afternoon. Are there any severe or critical cases that were observed among these 3,900 COVID-19 infections in students?
Sean, just to be very clear, that infections were from the 12 to 17 age group and not just specific to students. Now, the DOH said they're still waiting for reports as to the number of infections in schools. But these infections were recorded from the 1st of September to November 3. Now, there are no reports of severe and critical cases, and the DOH is again still waiting for the reports as to the number of infections in schools. Sean.
All right, is the DOH still in support of the full implementation of face-to-face classes then?
Yes, Sean, according to DOH OIC Verhead, they are still in support of the full implementation of face-to-face classes, saying that this benefits the mental health or the mental well-being of students 2 years into the COVID-19 pandemic. Sean.
Right, did the DOH give any indication as to when we can expect children aged 5 to 11 to receive their booster shots?
Sean, it remains to be seen, as according to DOH, there is still no recommendation from experts when this age group will be able to receive booster shots, saying there is no enough evidence of its benefit for this age group. Sean.
All right, and what about the policy about masking inside schools and offices? What is the position of the Health Department when it comes to that?
Sean, amid the easing on the restrictions on the use of face masks, the DOH said that these boil down on a person's informed choice or informed decision. If you are vulnerable or if you are in a high-risk area, still choose to wear your face mask. Sean.
All right, there's also this new virus, JC, I'm not sure I'm even pronouncing it right. The respiratory syncytial virus. So the DOH has logged over 200 cases of this. Anecdotally, a lot of people are also saying it's going around. What is this exactly? How do we pronounce it? And should we be worried?
Sean, according to the DOH, these infections were logged from January to August 31, 2022. And according to the US CDC, this is a common respiratory disease which causes mild and cold-like symptoms. Now, this infections, or there are reported increase in cases among children in the US. And the DOH said kids or even adults may get this through respiratory droplets and transmission. Now, according to the agency, among the symptoms of this virus include colds and fever, but patients or those who are sick eventually recover from RSV. Sean.
And is it as contagious as the coronavirus?
Sean, there is no mention as to that, but according to the DOH, it's still like COVID. Its way of transmission is through respiratory droplets. Sean.
All right, thank you so much for those updates. JC Cosico reporting to us live from Manila.